Hello, my name is Mark McDonald. I'm a registered nurse, and I have been for quite some time. I'm presently the Consulting Director for Clinical Innovation and Government Health here at First Health Advisory. Now, I became a nurse primarily because I wanted an interesting environment. I wanted to have work that would pay well and would enable me to help people while also raising a family. So I began in a 3-year hospital-based nursing program in Pennsylvania, worked in critical care, inpatient mental health, and then got a commission as a nurse in the United States Navy. I was quickly found myself on the hospital ship Comfort for Desert Shield, Desert Storm, and then subsequently had deployments over to Somalia and to Cuba. After about 7 years of active duty, moved to the Navy Reserves and began working full-time in civilian hospitals here in Jacksonville, Florida, worked in the emergency room and also as a hospital supervisor. But I wanted more, influence in healthcare delivery rather than just one patient, one family at a time. So for me, that path was information technology. Returned to school, I got degrees in computer programming and information systems. Began a project at that local hospital, transitioning the emergency room from a pen and paper based triage to an electronic version of triage as well as electronic tracking. From there, I moved into the consulting realm and have spent several decades working in many hospital systems and with EHR vendors, helping to adapt to the shifts in clinical workflow and documentation that were being implemented. Some of these vendors included companies like Cerner, Eclipsys, Allscript, MedHost, and NextGen, and even 3M. A lot of the efforts were around workflow optimization, patient throughput, revenue cycle, and simply adapting the clinical operations of nurses and doctors to how an EHR operates. I've done this not only in civilian hospitals, but also with the Department of Defense and Veterans Health Administration. And this long path finally and directly led me to First Health Advisory and their culture of excellence plus agility. And I'm very happy to be part of the best company I've ever worked with.